Hello, good morning. My name is Dr. Luis Rivera. I am the new faculty surgeon at Mount Sinai Health System. I am a breast surgical oncologist, and I have a practice at Mount Sinai Chelsea and Mount Sinai Beth Israel. Well, the first thing that I will advise any patient who finds a lump in their breast is to first seek a medical advice and a professional evaluation, keeping in mind that most breast lumps are benign. So for this reason, first and foremost, you need to get a medical evaluation, obtain a physical exam by a professional provider, because that physical exam, and depending on the signs and symptoms, will determine if the patient will need further testing in the form of a mammogram or ultrasound. A mammogram is essentially an X-ray for your breast. It takes, there's two forms. There's a diagnostic mammogram or a screening mammogram. Screening mammograms are recommended to start at age 40, and this is for average women with average risk of breast cancer. There are a certain population of women who are elevated risk of developing breast cancer, and so mammograms are recommended to start at early age. However, again, for average risk persons, mammograms can start age 40 annually, and they're essentially an X-ray for your breast. And the screening mammograms essentially a two-view, and the machine essentially has two plates, and they compress the breast in two directions, up and down and sideways. And essentially they take pictures, and the radiologist then evaluate those images. A diagnostic mammogram has the same two views as a screening mammogram, but in addition, it has other views and magnification views that are used to evaluate other fine lesions that are concerning. It is important to get regular mammograms because most of the time, breast cancer will present without any symptoms, meaning that a patient will be completely asymptomatic without any breast lumps or any breast pain. They will go for their mammograms, and they will see a number of suspicious findings that can range from calcifications, tissue distortion, or tissue asymmetry. And these are findings that will prompt a radiology or a radiologist, I should say, to perform a biopsy. The patient should expect to essentially go to the mammogram department, and they will be greeted by mammogram technicians, and they will be standing in a machine. And so if it's a screening mammogram, the patient will be standing in front of the machine with two plates compressing the breast. The patient experience can vary, but for the most part, it is a painless procedure. However, some discomfort can be expected depending on the compression of the breast. The results for screening mammograms are usually given within 24 to 48 hours. However, for diagnostic mammograms, on the other hand, because these studies was performed because the patient already had symptoms, diagnostic mammograms should have a report on that same visit at the moment, so we can determine if any further steps are needed. For screening mammograms, the results can be available between 24 and 48 hours. I will say though, most cancer centers, including ours, will have the report on screening mammogram at the same time they get the mammogram, meaning the patient comes to our center, they get the mammogram an hour after or 2 hours after they see their provider, and by that time they already have the report on the screening mammogram. Like I mentioned previously, for diagnostic mammograms, typically the results are available right away because that information is needed to determine if further steps are needed. Yeah, so I would just like to, make emphasis that mammograms are important. You're screening mammograms every year. Every patient should get it because multiple studies have shown that mammograms are the only study that's out there that can detect breast cancer early stage. There's sonograms, there are MRIs, which they're more sensitive study. However, mammograms remain the gold standard for screening for early stage breast cancer. And that's important because the earliest you catch this disease, the more treatment options the patient may have compared to a patient who, for example, may present with a late stage disease. So that's why it's very important for those women who have no significant risk factors to start their mammograms at age 40 in conjunction with the clinical breast exams every 6 to 12 months. And that's been shown to detect breast cancer early stage and can improve the prognosis and survival in these patients.